Hey everyone, Dr. Devin Atkinson here. This week we're going to take a step back and look at the system as a whole. Because if you've ever felt like the medical system doesn't really care about you getting healthy, you are not crazy. The truth is, it's not about health, it's about making money. And once you understand how deep this goes, you'll never look at mainstream medicine the same again. I want to highlight the important work being done by Robert F. Kennedy Jr. and the MAHA movement, Make America Healthy Again. RFK Jr. has been sounding the alarm on what many of us have seen firsthand, that government health agencies are no longer working for the people. They're captured by the very industries they're supposed to regulate. Big Pharma, big food, big ag, and big insurance. That's what's known as regulatory capture. And MAHA is calling this out boldly. America doesn't have a healthcare system. We have a disease management industry. One that's making trillions, keeping you sick, medicated, and dependent. What does regulatory capture actually look like? Let's take the FDA, the agency that approves the drugs we put in our bodies. Nearly 45% of its budget comes directly from the pharmaceutical companies they're supposed to regulate through something called user fees. That's like letting the student grade their own exam. Or look at the CDC, which owns dozens of vaccine patents and takes in millions in private funding from pharmaceutical and biotech companies. Can we really trust their recommendations to be objective when they're profiting from the outcomes? But it gets worse. Here's how the game really works. High-level officials at these agencies spend decades climbing the ladder in public service. Then, just before retirement, they start doing big favors for the industry they're supposed to regulate, approving drugs, blocking competitors, burying inconvenient studies. And the reward? A cushy executive job with a pharma company pulling in millions per year after they retire. This isn't a conspiracy, it's a playbook. And it's been repeated over and over, from FDA commissioners to NIH leaders to CDC directors. This corruption isn't accidental, it's engineered. And it trickles all the way down to your doctor's office. Let's talk about something most patients don't know. Insurance company bonus programs. Many insurance plans pay doctors more when they meet certain prescribing metrics. That's right. Your doctor could be getting a bonus if they prescribe more statins, antidepressants, vaccines, or blood pressure meds. In fact, a 2018 Blue Cross Blue Shield Physician Performance Program document showed doctors could receive up to $250 per patient who was prescribed certain recommended drugs like statins. Now ask yourself, when your doctor writes that script, are they doing it for your health or for a performance incentive? This doesn't mean all doctors are bad. Most went into medicine because they wanted to help people, but they're trapped in a broken system. One that punishes root cause care and rewards long-term sickness. This system isn't designed to make you well. It's designed to manage symptoms, keep you compliant, and keep you paying for life. If you get healthy, the industry loses a customer. If you take control of your diet, your movement, your mindset, your inflammation, they lose their leverage. That's why true healing isn't found in a pill bottle. It's found in personal responsibility, in education, in getting back to the basics of how the body actually works. RFK Jr. and the MAHA movement are putting a spotlight on what many of us have felt for years. We've been lied to, bought out, sold short, but we don't have to play along anymore. If you're ready to get off the medical treadmill and take back your health, I'm here to walk with you. Next time you hear someone say, "Trust the science," ask who funded it. Let's get real about your health, because your choices create your results, and no one can profit off of your wellness if you choose to own it.